Hello, everybody. Just getting started here. See some people are still filtering in, but we'll go ahead and get started. Hopefully, we'll get some folks in here, some more folks in the room. By the time we get to the meat of the content here, I'm just going to run through a brief introduction. So welcome to our panel discussion, Commuting During a Pandemic, a Regional Transportation Outlook. I am Alex Taylor. I am the Senior Business Development Manager here at Arlington Economic Development on the Business Investment Group. I'll be moderating today's panel discussion, which features obviously an excellent group of experts that we pulled together to speak on the state of public transportation in the region. Over the past several months, our staff here at AED has spoken with hundreds of companies about the impacts of COVID on day-to-day operations. And we're using these conversations to drive a dialogue around several critical topics, one of them obviously being transportation. So over the next few months, we'll be covering a range of topics. Obviously, public transportation, we're leading off with that. It's really the lifeblood of this region's economy. It's how many of our employees get to the office, including myself, under normal circumstances. And my typical job at Arlington Economic Development is to really pitch Arlington as an ideal location to operate a business to companies from around the world. And I think many of us do take for granted the robust infrastructure that the DC metro region offers compared to many other cities around the country. Companies that look at this market really view Metro as a huge asset, and it's a driving force behind many of the relocations and expansions that we see into the county and into the region as a whole. So naturally, we think it's very important to have a conversation around our public transportation, especially during these uncertain times. The goal of this conversation ultimately is to discuss the safety measures that are being taken by our regional partners, our transportation departments, to ensure safe passage during COVID, but to also talk about the future of public transportation in this region and how critical it will be to our daily lives coming out of this pandemic. So with that said, I'll go ahead and introduce our panelists all at once, and then I'll bring them on screen and turn it over to them for a bit of more of an extension, introduction, and background of what their roles are. But we've got Tom Webster. Tom is the Executive Vice President for Strategy, Development, Planning, and Program Management at WMATA. Dennis Leach is the Director of Transportation for Arlington County. And Dr. Lama Bu Mojahed is the Director of Research for Mobility Lab. So I'm going to go ahead and bring our panelists onto the screen here and unmute them. So Dennis, Lama, and Tom, you all should be coming onto the screen now, and the audience should. There we go. And myself, forgot to share my screen. All right, so Dennis, starting with you, can you introduce yourself, discuss your normal role as Director of Transportation with Arlington County, and then let us know how, if any way, your day-to-day job has been impacted by COVID?
Sure, happy to. Dennis Leach, Director of Transportation for Arlington. On a normal day, I oversee a pretty large portfolio. We deliver direct transit service with our ART program, paratransit. We operate all the traffic signals, traffic cameras, street lights, parking meters, parking garages, commuter stores, and we also do regulatory work. We oversee development permitting, development inspections, plan review, and then we've got about a $500 million capital program that we're responsible for. And in terms of COVID, for us, the real pivot was in the last 2 weeks of March. We had the governor's emergency order March 12th. We had the county's emergency order March 13th. And that was for us a very quick pivot. Complying with those orders, our first order business was figure out how we can keep our workforce, which is about 150 staff and 250 contractors, safe. And then we quickly transitioned to how do we sustain our operations and continue to deliver all of the services. And I can report that we've actually been able to deliver all of our services continuously through COVID. Nothing has stopped, including the capital program. But I would say we are our group is responsible for base program plus. So we had to keep everything going, but then we had special COVID related work, like retrofitting the way we operate our fixed rail transit system to make it safe for both our operators and our passengers through things like free fare, very enhanced cleaning program, disinfection program for ART. We actually put a lot of different measures in place, and we also got some requests from the business community when the governor shut down sort of on-premise business in a lot of places. We were hit with trying to repurpose all the curb space for pickup drop-off zones. We had over 400 requests, and we were able to install, I believe, between 170 and 180 distinct pickup drop-off zones. So that's a COVID plus. We also have been involved in implementing TOSAs, the temporary outdoor seating, to help our restaurants with work in the public right of way to allow for safe pedestrian passage. And then we were on the hook for emergency response from the first week of the emergency order through July. So I think of our work as base program plus.
No, that's a lot. So I appreciate that. We'll get into more details of what some of that looks like too as we continue the conversation. So thank you, Dennis. Tom Webster, turn it over to you. Do you mind introducing yourself? Explain what you do at WMATA under normal circumstances, and what have the last few months looked like for you? Oh, hang on, Tom, you're muted. Oh, there you go. You should be good.
Thanks, Alex.
Yeah. Sorry about that.
Thank you, Alex, and good afternoon, everyone. I really appreciate the opportunity to be here today on behalf of Metro. Again, my name is Tom Webster. I lead Metro's department responsible for strategy, planning, and importantly, managing Metro's program of capital investments for the rail system, Metro Rail system, the Metrobus system, and the paratransit Metro Access service. Our focus, our departmental focus and Metro's focus more broadly has been on building on the safety and reliability improvements over the past several years, where we saw higher reliability and on-time performance and recent ridership growth, of course, prior to the pandemic. We've also been working hard as a department and as a region on a regional effort to improve the bus network, including investments in bus priority and to move buses more quickly through our congested corridors. Of course, our normal, as Dennis said, our normal important work continues, but the pandemic has required some reorientation to address our immediate challenges, adapt our operations to this new environment, to focus on, importantly, the safety and well-being of our employees and our customers, and to develop and then implement a recovery plan to restore service in line with the regional reopening and economic activity across our entire region.
Great, thanks, Tom. We'll get into more of that as we continue this discussion. Lama, you're the head of research for Mobility Lab. First, do you mind explaining a little bit about what Mobility Lab does, and then what your role entails? I assume it's probably shifted a little bit during this time, but you do quite a bit of research and studying of transportation, so I assume that part hasn't changed. But do you mind giving a little background on Mobility Lab and then what your role is? The organization.
Sure. Yeah. Can you hear me, Alex? Yeah. So thanks, Alex. Yeah, as you said, I'm the research director at Mobility Lab. We are a research and communication source in Arlington. We're actually part of Arlington County Commuter Services, which is a division of the Department of Environmental Services. So we focus on transportation demand management research, so how people make travel decisions, and more specifically, how they shift away from single occupancy vehicles into more sustainable modes like transit, bike, walk, etc. So I think that the gist of what we do has not changed during COVID. We're still doing the same research, as you said, but actually we just need to now account for an additional dimension when we study mobility and travel behavior, which is COVID.
That's really helpful. Thank you. And so we'll be probably turning to you to get an understanding of maybe what other metro areas are doing, other cities around the globe, in either past pandemics or even under this pandemic, because there are some countries that are obviously a little bit further ahead than we are. So thank you for that. Well, welcome to all of you. Thank you for those introductions. I think it's really helpful to set the stage for our continuing conversation here. Really, you already hit on it a little bit, each of you, on the impact of this pandemic on our regional transportation infrastructure. But Dennis, kind of starting with you, obviously, there's been a huge impact on the Arlington system, but I think it is important to emphasize that the transportation system's never shut down. You mentioned, Base Program Plus, and how you've adapted to this new environment. But can you speak to maybe some of the initiatives that have been taken on within Arlington transportation to make sure that the impacts of COVID are not far-reaching or hopefully, short-term as we work through the pandemic?
Sure. So I would say first, again, in the theme of we never shut down, ART ran 7 days a week from the beginning of the pandemic, and we have gradually ramped service up to close to normal levels as the environment has gotten safer to do so. Some big changes here. We basically saw the elimination of rush hour peaks. We still saw traffic on our road network, but it was really pretty evenly distributed throughout the day. We saw fairly dramatic drops in transit service across all the providers that serve Arlington. A little bit less on bus. Tom will be talking about rail. But we were transporting essential workers basically every day during the pandemic response. We also looked at the effect of COVID and reduced traffic on how can we actually get some additional work done. So some work actually got accelerated. We eased restrictions in terms of work in the right-of-way for our private sector. So development projects actually moved more quickly within right-of-way utility work. We continue to advance all of our construction projects and gained a little bit of traction there because of reduced traffic. So we continue to implement projects. We had some major projects that actually got, if it wasn't for COVID, we would have had a ribbon cutting. So projects like the Clarendon Circle project, which was a major reconstruction in Clarendon, Rosslyn Gateway, our entrance to Rosslyn was rebuilt. The west end of Columbia Pike, the sidewalks got installed. So there was a lot of work being done even as we're responding to the pandemic. And that's really setting us up for post-COVID recovery.
Great. Yeah, and I think we'll dive into that a little bit more towards the end, because we're definitely interested in hearing about kind of the future and what people can expect when they get back to the offices. I imagine some of those projects that you mentioned, Dennis, will come as a surprise to some folks who maybe haven't had their feet on the ground in Arlington for some time. And Tom, I imagine it's pretty similar within WMATA. Obviously, everything stayed running through the pandemic, some and continues to stay running. I shouldn't say that if it's past tense. But can you speak to kind of the overall impact this pandemic has had on the Metro Rail service, kind of alluding to maybe the first 3 to 6 months? Because I know you're back up and running, so maybe not too much emphasis on what had happened, but really where do things stand now? I think you're almost at capacity with the rail service and bus as well. Can you go ahead and just speak to what you all are doing as an organization to ensure things are running smoothly and that folks who need to get on public transportation are safe to do so?
Yeah, of course. So as you said, in March, we substantially reduced service as the region was implementing the stay-at-home orders. But we did never stop operating, reduced service quite significantly, availability of our workforce, and frankly, to discourage travel across the region. But we saw, as Dennis mentioned, that we continue to provide service for essential trips, for essential workers, for things like medical appointments, grocery stores, and particularly on the bus. We saw a pretty rapid drop and decrease in rail ridership, not as much on Metrobus, and I think that's an indicator of who's riding our bus system and our system in general. So in August, Metro restored rail and bus service to near normal levels. Rail is close to our normal pre-COVID schedule and capacity, and bus, with the limitations that we do have still with workforce availability, is close to that level as well. Not quite at full service. Some routes not operating today, but a substantial improvement over where we were in March and over the summer. I think importantly, our recovery plan was developed to be flexible. We're going to continue monitoring developments and of course continue to focus on safety and well-being of our customers and our workforce, to continue working with our local partners, our state partners, and the federal government, and make further changes as we need to as we move through our phases of recovery and resuming, regional economic activity and regional activity more broadly.
That's helpful. Yeah, and I think it's significant. This region relies so heavily on public transportation. So does the federal government, and obviously they're a big user, and their employees are big users of the system. And that's a massive tie into the federal government as well, which is, I think, probably unique to our infrastructure. But yeah, that's helpful to hear. So thank you. Lama, do you mind speaking to some of the trends you've seen around the globe with infrastructure, public transportation systems during COVID? I know, we talked about previously how some Asian nations are a little bit ahead of the curve because they've been through a couple of these pandemics now. But are there best practices or use cases that we can look to around the globe with this pandemic, maybe where they have they're a little ahead of the curve and have started implementing some procedures that maybe we're already doing? I imagine WMATA and Arlington County are probably at the cutting edge of implementing the best practices already. But as far as ridership and what riders should be expected to do going forward, is there any insight that you can provide there?
Sure. So as you said, around the globe, they're ahead of us. So we had seen during the pandemic, obviously there were lockdown measures, stay-at-home measures. So ridership did drop. The Washington Post, for instance, in May showed there was like a 90% decrease in major cities like Paris, London, and Tokyo. But because they've had more time, their economies reopened. We've also seen them recover. So Paris is now, or in August, was at 60% of ridership. Even in China, we've seen some from 70% up to 100% reporting recovering to pre-pandemic levels. And if you want me to talk a bit about what they did in terms of strategies, what they are asking travelers to do and what they're doing, I can talk a bit more about that too.
Yeah, that'd be great. I think, I know Dennis will probably hit on it a little bit as well, but yeah, if you could speak to what passengers are being advised to do in those countries. I assume it's similar to what the guidance is here, but.
Yeah, similar public health. I think that different agencies are doing different things and it's changing over time. But in general, I can group them under 5 main groups. So one is what they're asking safety measures of what travelers should be doing. 2 is the cleanliness that the transit agency is assuring is there. 3rd is the digitalization, so contactless payment. 4 is social distancing measures and flow management to make sure there isn't overcrowding. And I think 5, importantly, is communication. And I can go into more details in each of these. But yeah.
No, those are very helpful. I appreciate it. Dennis, looked like you were going to jump in.
Sure, I was going to say we worked on all those for our. Now, granted, we're not the size of the system of Metro, but we put in enhanced cleaning disinfection pretty soon after COVID hit. That was in place probably in the first week of April. We put in free fare boarding, rear door boarding, requiring everyone on all our passengers to wear a mask. We also blocked off seats to make sure that there was adequate space on the bus. We were also prepared to insert buses if we saw any evidence of crowding. So we had buses and drivers in reserve. So if we saw an evidence that this one route is actually getting a little crowded, we inserted another set of buses in to actually relieve that. And again, communication is key. It's getting people comfortable with those enhanced personal safety practices, and then getting comfortable with the system is safe.
Yeah. No, that makes sense. And Tom, I was going to kind of pivot to you because Lama brought it up, but I know you're going to mention the contactless payment that WMATA is working on for, I assume, all Smart Trip cards. But could you get into that? Because I think that's something that folks might not realize is happening. I know it came out in the press, but can you speak to that a little bit?
Yeah, so we're really excited about this. We have been working for some time with our partners on developing a mobile payment, and this week we announced and launched the mobile payment option with iPhones and Apple Watch, which will work with all of our regional transit providers anywhere a Smart Trip card works on rail, bus, throughout the system. Android, it will be released sometime later, but not too far behind. Smart Trip and iPhone on Apple Watch will as Dennis mentioned, provide riders that sort of touch-free experience and a safer way to pay. They won't need to touch the fare vending machines, the card readers, or any of the equipment in the station, which is really a pretty remarkable change for our customers. And again, very excited about it, this sort of transformation.
Yeah, that's a huge day-to-day, non-pandemic infrastructure change. I think that a lot of folks will be excited to see now that it's going to be in place. It doesn't surprise me that we're already implementing sort of what the rest of the world has done. I think we obviously have strong communication within our divisions. I think that's one thing. Dennis, when you and I touched base on this topic back in July, you stressed that Arlington was constantly in communication with WMATA and Fairfax and Montgomery County, DC, that there was constant communication because we are an interconnected system. So it sounds, Lama, you mentioned communication. I assume that's communication out to the general public on riding standards, but I also think it's important to have communication between government agency and the public on these initiatives. And I know that there are efforts underway to tackle that. And that's not really a question.
I'd like to just chime in, Alex.
Go ahead. Yeah.
But I would say that the transit properties around the Washington region collaborate intensively and continually. So any special event, any emergency response, all of the operations staff from across the region are working together. Here in Northern Virginia, there are a lot of different transit properties that serve Arlington. We're in communication with all of them. So the strategy that we have for bus service is essentially coordinated across all the properties, whether it be our green and white bus, a Metrobus, a Loudoun County commuter bus. We really try to make it as seamless as possible, and we're all using the same fare media with WMATA as the lead.
Yeah, that's great to hear, because a lot of it does happen behind the scenes, and I think it's expected and it's a best practice, but obviously in this region it has to happen more than probably any other. So thank you for speaking to that. And I do want to hit on the survey results that we got. Everyone who registered for this panel discussion had to answer a series of pretty unscientific questions. I don't know if I would draw any crazy conclusions from these or draw research papers around them, but I thought they were pretty interesting. And so maybe you all can speak to that, and it'll probably frame up the next part of our conversation. And I think we've already hit on some of the solutions here, but just 25% of the attendees stated that they were comfortable riding public transportation in the current environment. And an equal number, so about 25% said they need more information to make a decision, so kind of in that undecided category. And then 50% said that they were just uncomfortable. Of those that said that they were not comfortable riding public transportation, though, only 30% said they would wait or require a vaccination for COVID to go away before getting on public transportation. There's about 70% that are either uncertain, which is a big chunk, or would like to know more about the safety protocols that are being taken before hopping on a train or a bus. So out of the 100 or so folks that we've got on this webinar, 70%, so even number, 70 also said that they have not heard about the protocols or the safety mechanisms in place. So I think there's an educational piece that can come from this. And I also don't think a lot of people have really thought too much about it. I know I haven't, because I know we're not returning to the office tomorrow. But at some point, whether it's when there is a vaccine or there's or the pandemic kind of fades away, whether it's in the spring or the summer or the winter, fall, people will have to start paying attention to public transportation again, because it's a backbone for our economy, and we need that ridership to return to pre-pandemic levels when I say get back to normal, but obviously it won't fully be back to normal. So, Dennis, can you, with those results in mind, can you speak to how Arlington County is pivoting to adapt this mentality? Because obviously we want to get consumer confidence back. Part of it might be an educational piece, but part of it might just be a understanding that there is a point that people will be comfortable to get back on transit, and it might not be until the pandemic subsides. And so obviously we're not seeing a mass return to the office anytime soon, but there are companies that will probably be asking their employees to return to the office at some point this fall, even if it's just part-time. And Metro and Arlington Transit are really ahead of the game here on sanitization and distancing protocols. I know you mentioned that riders probably won't be as exposed or just as exposed on public transportation as they would be in any other public setting. So could you speak to that? I mean, I don't expect us to all convince people to get on Metro or Metrobus or ArcBus tomorrow, but if folks on this call, on this webinar, had to get on Metro, what would you tell them about what's in place? And Tom, you can also answer this as well, speaking directly to Metro, but Dennis, in terms of like Arlington, I know there's a lot going on. So can you speak to that a little bit?
Sure. So I do think we've got more work to do on education. I think pushing out our safety video, working with Metro to get the word out, that if you apply your own protective measures like wearing a mask, probably carrying hand sanitizer, you should be able to get around just fine. And I think about it, I do occasionally go in the office. And to me, it's kind of a continuum from the time you leave your house to use transit to an elevator going into your office building to using shared facilities such as bathrooms, kitchens, copiers. I think some of the challenges that I see are really those in office. How do you make those safe? So I actually think the public transit piece of that is less of a hurdle. And so it really is, if people really protect themselves and be respectful of others, a lot of this coping with the pandemic, showing mutual respect for the other people around you. If everyone wears a mask, if everyone actually maintains good hygiene and doesn't travel when they're sick, we can do okay and manage the situation until a vaccine is out. But I would say it is a continuum of risk from the time you leave your house to the time you're sitting in your office. And to me, the public transit piece isn't necessarily the most daunting of those. I think we need to be thinking about safety and risk across that whole continuum, and even going to the grocery store. You're going to have some risk, but if you take certain precautions, those risks managed.
Yeah, that makes sense. Tom, I imagine you probably have a similar thought on that, but can you kind of speak to what Metro is doing in enforcing distancing or recommending that passengers kind of approach the Metro ride experience? I imagine it's no different than what Dennis just said, because you all are communicating and implementing similar practices, but can you speak to that a little bit?
Yeah, of course. I think, as I mentioned, this sort of foundation of our plan from the beginning here has been safety and well-being of our employees and our customers. So, as we developed our recovery plan, we thought really important to ramp service up and ramp capacity back up ahead of when larger numbers of customers would return to the system. And that will allow, obviously more capacity, more space on our buses and trains, and allow us to minimize crowding during the recovery period. So we increased service in August, even though our regional activity has not yet picked up, and the schools in most of our jurisdictions have not returned. So again, focusing on safety, we have significantly enhanced safety measures, including our daily cleaning and disinfecting of trains and buses and stations, regular, even further deep cleaning of stations and public-facing areas. As Dennis mentioned, we implemented the rear door boarding on buses to minimize some of the interactions and allow some more space. And then we've, implemented things like safety shields on buses and elsewhere. I think importantly, though, it is difficult or near impossible to enforce distancing or certain behavior types, mask wearing throughout a system of our size. So it's really critical that, as Dennis said earlier, that our customers and our region recognize sort of personal responsibility and what an individual customer can do themselves, staying home when they're sick, wearing their mask or face covering, maintaining that safe social distance whenever that's possible.
Yeah, that makes sense. And so, Lama, turning to you and kind of look at the global picture, obviously, I did refer to Asian countries and Asian cities previously, but there is a mask wearing culture there because of their pandemic experience on public transportation that just doesn't exist in this country, and has taken some time to take hold, and it's still controversial and somehow. But can you speak to what is being done? You mentioned the social distancing and flow management in other cities that are starting to return to near pre-pandemic levels. Can you speak to what it is that they're doing? Is it wear a mask, wash your hands, stand 6 feet apart? Is it that simple, and they're following the rules?
It's more than one thing. So in terms of what they're asking, yes, it's simple. It's wear masks, it's wash your hands before and after every trip. It's don't talk on board of transit if you can while you're on transit. In terms of social distancing, I think there's a lot that they're doing, and we talked about the Asian countries having more experience with this because of previous diseases. So as soon as the pandemic started, I think they implemented things like flow management. So there was someone in the stations telling people to queue outside instead of queuing inside. They had other mechanisms like drivers were really monitoring the carts, so the weight of the carts, how many people were there, and telling them to change cars to increase social distancing. There were also some apps, not only in Asia, but also in Europe, that were used for people to either check how crowded cars are and then decide whether to travel or not, or even to book in advance. That was a trial to book in advance seats on transit to ensure social distancing.
That's really interesting. This is kind of a question maybe for both Dennis and Tom. And Tom, you're unmuted now. I was going to ask this later, but are local transportation networks looking into different technologies that are out there that might help with flow management. You know, there's a lot of smart technology out there that I know building owners are looking at to work on flow management and sanitation and obviously cleaning the air that's moving through the building. Is that being looked at a transportation level? This is kind of off the cuff. I don't talk to anybody on here about this previously, but I know that's something that you're looking at from an economic development perspective, because we're looking to find companies that are being innovative, whether it's here in Arlington or around the region or the country, that could be bringing solutions to government that maybe never would have been considered outside of a pandemic. Or were you already looking at those technologies? I'll kind of turn it over to either one of you to answer that.
I'm going to start, then I'll kick it to Tom. I'll say right now, given that we are still in the pandemic, we went low tech initially, which means even every one of our bus operators is in touch with our dispatch. So if they have any evidence on a bus that they are driving, that there is potential for crowding, it's called back into dispatch and additional buses are inserted. Now, what that means from an operation standpoint is it means having an extra reserve of buses and drivers available to deal with unanticipated peaks. I would say in terms of the transit network that's serving Arlington, by and large, we're still very, very far below that. I think certainly local bus and regional bus, we have more people. And I would say from Art's perspective, we're managing it. I'll let Tom talk about Metrobus and Rail.
Yeah, thanks Dennis, and thanks Alex. I think yeah, the one thing we already talked about, the mobile application was something obviously we had in the works, and it immediately helps with passenger flow within our stations. But you know, shortly after this the pandemic started, we formed a pandemic task force. And one of our emphasis points there was to examine technology options, talk with our partners across the country and internationally, and then within the resources we have, try to advance new technologies and new systems. So yeah, like Dennis, we many things were very low tech at first, and responding to things like bus crowding with an extra bus here and there, and our focus, as we discussed, was to go as quickly as we could to a level of service that created that additional capacity. We're continuing to look at those technologies, and you know, to the extent that something is feasible and can be deployed in our system, we'll move forward with those, and that covers everything from measuring crowding and providing information about that, to new technologies in cleaning, and deploying those in obviously our public spaces and spaces where our workforce spends most of their day.
Alex, I would like to add one thing. That this is a technology that we've been building out for some years, which is our fiber network and our ITS cameras. So Arlington probably has the highest density of cameras in the right-of-way in the region. And for special events, emergency response, they're invaluable. And we also have access, our emergency responders transportation have access to the mezzanine level, the metro. So we can monitor everything from the entrances down to the mezzanine to see if we're having any issues with crowding. Pretty much for every inauguration, every special event, that we are using that technology frequently.
Yeah, no, that's something we do talk about at the county level when we're meeting with outside stakeholders, is the Connect Arlington fiber network and the technologies that are coming forward now, that are coming to the commercial market, that are going to be able to tap into that infrastructure and really, you know, leverages rapid response in terms of emergency situations, but also now in an environment where you want to manage crowds, maybe more so under normal circumstances or under pandemic circumstances you might have thought going into the year maybe, but that's good to know. Yeah. Well, and this is kind of for both Tom and Dennis. So maybe start with Tom on this one, but obviously we're not going to be snapping our fingers and going back to normal ridership capacity anytime in the near future, at least. It'll probably be gradual. Companies will probably bring back certain employees slowly. I think a lot of it will probably be tied to the school systems, because if daycare and schools aren't doing in person, it's hard for folks to get to the office even if they wanted to. So assume that there won't be a finger snap and return to the office until the pandemic is mostly eradicated. But should companies need to get their employees back into the office for any reason, if they have critical contracts or they are critical infrastructure, what can you share with us? I mean, I think we've already hit on a decent amount of it through the conversation already, but what is the metro capacity or the bus capacity with social distancing? Is there a percentage? Can you go back to 40%? I mean, Mama mentioned that some of the European and Asian countries are back to 60, 70, 80% capacity. Obviously, they've handled the situation a little bit better. They might be in a safer environment. But what would be the capacity with social distancing that the infrastructure could handle if you had a return tomorrow of maybe, if a third of our companies decided, hey, we're going to bring back 50% of our employees? I assume that would be handleable. It's got to be around, what, 35, 40, 50% of social distancing? Is that accurate?
Yeah, it depends on whether it's bus or rail. I can talk about it a little bit. As we said, our objective has been to put out as much service as we possibly can within the resources we have available. And so from an infrastructure standpoint, from a vehicle standpoint, we've deployed virtually everything we have within those resources. And our plan is to continue to stay in sync with the regional reopening plans, and that service level positions us quite well to handle ridership growth in the fall and into the winter. Social distancing does reduce the capacity of a train or a bus considerably. If there's sort of strict adherence from our customers to social distancing, it decreases capacity on a bus to about 12 or 14 people, and about something in the 20 to 30 people range on a rail car, and so that's a substantial reduction. We don't expect to see ridership grow beyond that capacity in the near term in the fall. So there should be plenty of space for those who have a need to return to the office and would like to do so to take transit.
Dennis, do you look like you're going to hop in? Or?
Yeah, so I would say that in Arlington, we depend on a whole variety of forms of travel to get to work. So it is, I believe in our metro corridors, approximately 10% of the people walk to work. Yeah. That's probably safer now than it was before the pandemic because we've implemented additional projects. We've continued to improve our bike network. So biking is a viable option if you live, say, anywhere from 2 to 5 miles or 7 miles away. It may be possible to get here to your job by bike. Also, I would say I am envisioning this kind of blend of telework and in office. And the really hard thing for our transportation system is when everyone wants to travel between 7:30 and 8:30 in the morning, and then wants to leave the office at 4:30 or 5 en masse. There is tremendous capacity in the transportation system, particularly in transit, when you think about it as an extended day from early morning through midday through the evening. There is a tremendous amount of ability to move people, even with social distancing. And the same is true with transit. Again, so I think this blending actually of telework and in office could really help us in the transition. Get people flying transit several days a week, maybe not at the peak of the peak. But there is a reservoir of capacity there, in my view, that can handle any amount of travel that Arlington may generate.
Yeah, even if it was, if you're bringing back your workforce and you stagger it so that a third is teleworking, a third is coming in at 8, a third is coming in at 9:30. I imagine that would, if everybody did that at the same time, would greatly reduce, the congestion during peak hours. But I do want to shift kind of the conversation here to looking forward in the future, because we only have about 13 minutes left here. And I want to get to these topics. And we do have a question from the audience that hits on kind of infrastructure. So Tom, I'll turn that over to you to answer momentarily. But we have an enormous infrastructure in place. Our public transportation, as we talked about, is a huge asset. So 12 months from now, hopefully 6 months from now, but let's just say spring, March, April, May 2021, the pandemic has subsided. Folks are coming back to the office. It might still be a blend, Dennis. You might have a third of the people teleworking. You might have, 2/3 back in the office. But there will be people getting back on public transportation for the first time in a considerable amount of time, and there will be a lot of changes to the infrastructure, and all of them are for the good. Tom, you already talked to the smart trip, digital paying, hands-free paying. Dennis, you kind of on some of the street infrastructure that has been improved and projects that have gone forward. But can we talk a little bit about some of the infrastructure projects, Tom? Specifically that we have a question about the East Falls Church bike and ride, I think it is. I don't know if you or Dennis have an update on that. I think it was close to being reopened or opened, I guess, for the first time. And also maybe, Tom, if you can speak to the Silver Line extension a little bit as well. I know there's not a firm timeline in place, but it seems like it'll be close to delivery in 2021. So a lot of folks might be coming back to the office and getting on the Silver Line for the first time, especially in Fairfax and in Loudoun counties, where a lot of employees commute from into Arlington and vice versa. And so that really opens up. It takes cars off the road. Dennis, I mentioned that, fatalities and injuries are way down because there's fewer cars on the road. And so at the end of the day, public transit is actually the safest option. You're safer getting on a train or a bus than you are in a car. And so as people look to get that ridership back up, get to 80, 90, 100% pre-pandemic levels, what can they look forward to? Tom, go ahead and go to you. Oh, Tom, looks like you're muted. I'm trying to unmute you here. There you go. You're good.
Thank you. So, I appreciate that. As the pandemic hit, we did have projects that experienced some capital infrastructure projects that experienced some interruptions as we had to work through distancing and safety protocols for construction. But we also saw the opportunity with reduced ridership to really double down on some of our reconstruction programs, throughout the system and in particular in Virginia. So our project to reconstruct our outdoor platforms at 4 Orange Line stations west of Ballston is proceeding ahead of schedule, in part due to more time to complete the work with lower ridership. We've reopened East Falls Church, West Falls Church, and the Silver Line stations, and we expect Vienna and Dunmorring to open soon. You mentioned the East Falls Church bike and ride project. We had obviously well covered difficulty with that project over a number of years. Pleased to say that that's now finally open and available. So customers will see across the system that we were able to do some important work more quickly as they return back. Not just in Virginia at those stations, but elsewhere, and some critical behind the scenes work as well on our radio and cellular projects to improve communications within the system. Some of that sort of less sexy stuff that is really critical to the to safety and reliability of the system.
Yeah,
in terms of the Silver Line, construction continues to progress there, and as I think everyone probably knows, there are some construction quality issues that still have to be worked through with the airport's authority and the contractor before Metro can accept the project and begin to prepare for operations and set a service date. We're optimistic that those will be resolved, and we'll be able to set a date at some point in the reasonably near future. Obviously, that'll be a great asset for the region, connecting a corridor with tremendous number of jobs and residents with the rest of the region, and we really look forward to that.
Great, thanks. Dennis, and anything from your side on that? I know you mentioned some of the road infrastructure projects. I know there's a lot of bike lane work in Arlington, not just moving cars, trains, and buses, but moving people, whether it's on bike, foot. But is there anything you wanted to kind of emphasize that work did not stop? So people will be kind of stepping foot in Arlington if they don't live there. They just work there, and really seeing some pretty substantial changes to the infrastructure.
Yeah, so I'll start with some trans changes. So right before the pandemic hit, we put 14 new buses into service on ART, and transitioned to a new contractor. So our operational reliability, on-time performance is significantly improved. So people come back to ART. Their experience will be on a younger fleet, on a fleet that is much more reliable than it was in 2019. We are also looking to implement bus priority, looking at opportunities to give bus and both ART and Metrobus a better chance at staying on time, giving it an advantage. And so we're working on a plan to roll out later this year. We're reconstructing the Ballston Metro Transfer Center. It's one of our oldest. It was built when Ballston was the terminus station for Orange Line back in the late 70s, early 80s. So that probably should be done sometime in 2021. So they'll have a brand new plaza, real-time information, much enhanced shelters, a much better experience for the 10,000 plus people that go through that plaza every day. We are also in design for extending our transitway for Crystal City in through Pentagon City. We're in construction now for transit facilities along Columbia Pike. So there's just a whole portfolio. We've got 2 metro station entrance projects that we're advancing. One in Crystal City, the east entrance on Crystal Drive. We also have Ballston west entrance, serving the west end of Ballston. All that stuff is moving during COVID.
Great. That's good to hear. So thank you. And I think it's underrated, mentioning the Silver Line and the connections into Arlington, but it's talked about a little bit, but not covered. And I'm sure it will be as we get closer to the Silver Line opening. But the fact that most of our commercial corridors and hubs around the entire region, so Maryland, DC, Virginia, will be connected to 2 airports via Metro. You can actually connect from Reagan to Dulles, or will be able to, if you have a connection solely by Metro. So I think that's pretty neat. Now, I'm sure there's other European cities that are connected in some more ways, but I got to imagine that's pretty revolutionary from a transportation infrastructure standpoint. So and maybe a lot of people aren't thinking about air travel right now, but at some point it'll be back on the forefront, maybe 2021, 2022. So that'll be something to look forward to. I do want to quickly pivot. We don't have a huge hard stop at 2 o'clock, but I do want to be mindful of time here. So I want to get to a couple of the questions that we have that came through. One of them, and actually probably combine a couple of these, but one of them involves ventilation on buses and trains, and our local transit providers enhancing ventilation. If so, how? And then how are the local transit authorities working with health agencies to facilitate contact tracing? Are those issues that any of you can speak to? I know that's a little bit in the, more probably on like the public health side, but I don't know if you all have some understanding of what's being done here.
I'll give you the local perspective. So head of transit consulted regularly with public health at the outset of the pandemic to make sure that we were putting all the steps in place to make sure that our bus operators and our passengers were safe. And so some of the protocols that were put on ART were a direct result of those consultations with the best practices communicated by public health. Again, the daily disinfection of every surface inside an ART bus, the regular change of filters are all part of that.
Great.
Similarly, Alex, you know, I mentioned earlier, we formed the pandemic task force at the start of this the COVID outbreak, and again, a big part of the emphasis there was to make sure we were in very close contact with public health agencies across the region and assisting where we can with information sharing about you know all matters related to COVID. I think an important note: we are looking at ventilation on rail cars and buses and other opportunities and technologies in addition to the regular cleaning. But it's important to note that our ventilation systems on our rail cars and buses have more air changeover than your typical office building or you know home. It's a built-in part of the systems in those vehicles. So of course we're going to continue to look to see what we can do to enhance that, but you know, not a major obstacle to commuting with that enhanced cleaning and other work that's happening.
Great. No, that's helpful. Thank you. And the question for all of you, it says top 3, so I apologize to the audience members who submitted this because we're short on time. I'm just going to say each of you give one technology that you could have or invent to help make the travel experience safe. So I don't know how, if you get well, Arlington reference here with DARPA. I don't know if you want to go into the DARPA world of things that aren't created yet, but maybe the government is currently working on. But Lama, I'm going to start. I don't know if you kind of hinted at some of the technologies that have been implemented in Europe and Asia, and obviously we've got some of those in place now. But is there something that you know of or wish existed that you would roll out in this time?
Maybe.
A little bit.
That's all right. Maybe in helping me plan my transit trip is knowing how crowded the station is and how crowded the cars are. So maybe that app that tells me in real time where I can go to maximize social distancing.
Okay, yeah, that's great. Tom, do you have anything?
Yeah, this is a great, really great question. I'm gonna go with my go-to here, and that's something that makes the buses move through congestion faster. There's really nothing safer than that. You know, that's a very complicated problem to deal with. So some futuristic technology that the bus flies over cars or something like that.
Yeah, some sort of a flying bus that would be kind of solve a lot of our issues. Yeah. Dennis, anything that you can think of?
Yeah, I'm going to piggyback on Lama's comment. I think anything that gives our potential passengers really good information that makes transit easy across not only rail but bus, tells them when it's coming, when they can get where they want to go, what they can expect in the journey. All of that reduces stress on our passengers.
Yeah, that's great. And then I think that's it, unless I'm not seeing any more of the questions. There's a couple here on budget and ridership impacting budget. I don't know if that's something that anybody can speak to, or I assume that there's concerns around budget just naturally, but that's not a WMATA or an Arlington transportation problem. That's a local, regional, state government, federal government conversation that I think is happening across organizations. Everybody's learning to be flexible. Yeah, Tom, go ahead.
So I can speak to it just briefly here. I mean, the COVID has had a very dramatic impact on all of our budgets and all of our resources. And with the drop in ridership and the associated drop in revenue, we're very fortunate to be able to continue to provide the level of service that we're able to provide now, in large part due to the CARES funding from Congress and the federal government. That does come with a an end date, and so there are some potentially very difficult financial discussions that we're going to be having this fall about what happens if there isn't another aid package to sustain transit in this region and across the country.
Okay, thank you for speaking to that.
Yeah, and I would actually just like to add, so Arlington is a compact member with Metro, so the financial and operational health of Metro is incredibly important to Arlington. So making sure that Metro has what it needs to provide the service that the region needs is important. Our local service is also dependent on CARES Act funding. We're running free fare. So we've written off fare revenue at least to the end of the calendar year and maybe into the first quarter of next year. We'll see. But ultimately, as a region, we need to get people back on transit. We need to do it safely, but I think this region works best when it has healthy transit.
Yes.
Yeah, no, I think we can all agree with that, and I think it's critical to our economic infrastructure. If everybody who rides public transportation or rode public transportation before the pandemic got in a car and tried to drive into the office when the pandemic subsides, it's not going to work. I'll be getting back on Metro. Hopefully, it'll be the Silver Line as I commute from Fishburne to Ballston at some point. Looking forward to that. I fully, understand the importance of the social distancing, the cleaning, and wearing a mask if you're to ride it in the current environment. And hopefully, as we come out of this, we can start to get back to some level of normalcy, and that includes getting back to normal ridership capacity. And I know there was excess capacity on the transit systems even before the pandemic, especially in parts of Arlington. I think as the Silver Line comes on, that's something to really look forward to. And that actually, we are over the limit here. We're over time. I do want to share this slide with folks in the webinar here. These are the resources. We will send this out to attendees, and there was a question about whether this is going to be recorded. It is recorded. We're going to put it up on this website, Arlington Department, Arlington, Return to Workplace Toolkit, the top link there. That will be, that's on our AED website, and we have a number of webinars and toolkits up there for folks to dive into, kind of covering the whole gamut, returning to the office, returning to transit. This will live on that website. And then you see some of the other resources here, WMATA's COVID page, Arlington, the video that Dennis mentioned, the Art Bus cleaning video, check that out if you haven't seen that. So we'll be sending it out. You should receive an email with the recording, and it will also be live on that website. So that about wraps it up. I just want to say, thank you to the panelists. Really appreciate the time and effort you put into this conversation. This is an important discussion, and as mentioned, infrastructure, the transportation infrastructure is critical to this region. And hopefully, as we start to move through the fall and the winter, we'll start to see a little bit of a light at the end of the tunnel. And when that time comes, trust your public transportation authorities to do the right thing, which they're clearly doing here. And hopefully this was helpful to understand everything that is being done. So Lama, Tom, and Dennis, thank you again. Thank you to all the attendees for logging in and listening to us. And this will be the first of many webinars, or I guess it's the second of our series. We did one back in July, so check that one out as well. But we'll continue to do this content, push it out so that we can educate folks in Arlington and around the region about what our local partners are doing to move through this pandemic. So Tom, Lama, Dennis, thank you again. And thank you everybody for joining.
Thank you.
Thank you.
Thanks, Alex.
Bye, everybody.